Mhm.
A bill requires Oklahoma University Children's Hospital to stop performing gender-affirming care to get relief in order to get relief money.
OU Children's Hospital is one of the most well-recognized children's hospitals in the central United States. And I know at least a dozen or more kids who have gone to that hospital for treatment and care of various issues, injuries, and things that they suffer from. Oklahoma lawmakers passed Senate Bill 3 in both the House and the Senate that would hold federal money from the OU Children's Hospital unless it stops providing gender affirming care. Now, some lawmakers said this didn't go far enough. It should ban it everywhere, that it shouldn't just target the OU Medical Center. But the money that is federally granted to Oklahoma to issue to OU Children's Hospital was for a children's mental health center. The bill says that that money will come to OU Children's Hospital as long as they stop providing any gender affirming care to children. Now, the money does not have stipulations to that effect. This is the legislature coming in and adding a layer of requirement for the university to be able to get this money that was theirs to begin with.
That's crazy. I can't imagine this will stand.
It doesn't matter because in the next article,
Okay.
OU Health Center says that they are stopping gender health services after receiving pressure from the state.
Folded like a card table, huh?
Exactly. When the bill was introduced and it was basically, it was published that they were going to be doing this, they basically said, okay, we're not going to do this. Now, what does that do? It says that the bill would allow OU to build a new pediatric mental health facility, meaning that they are building a new facility that would help children who have mental health concerns. They are operating on a budget now from OU, and that doesn't affect it at all, said Representative Randy Randleman from Eufaula. But lawmakers said, we are not going to allow you to have $39.4 million if you continue to do gender affirming care at your facility. They will sit there and they will say, we want to help the children. We want to protect the children. We want to take care of the children. We need to look after the children. Mm-hmm. This is a children's hospital trying to provide advanced mental health care to the children of Oklahoma. Mm-hmm. Now, at the same time, they say transgender kids, non-binary kids, have a mental issue that needs to be treated. They have a mental health issue that needs to be taken care of. And because they want it done in a particular kind of way where it's conversion therapy, but the hospital does not recognize that as a valid form of mental health care, they're going to say, fuck it, let them suffer. Mm-hmm. And that's the hypocrisy that I want to talk about. It drives me absolutely batshit crazy that they will sit there and they will deem that the children are the future and that they're the most important part of our society, and then turn around and say, fuck you, kids, because your mental health doesn't matter as long as we get rid of these transgender people. Mm-hmm. That is hypocrisy.